It is very important that all of the anesthetic equipment is checked and ready for use prior to initiating this phase. The anesthetic machine should be regularly serviced and checked daily to be sure it is operating correctly. The carbon dioxide absorbing material should be checked and replaced if any clumping or bluish discoloration is noticed, or if it has been used for more than 8 to 12 hours of anesthesia time. A leak check, as being performed here, should be a regular part of anesthetic machine maintenance. Notice how the pressure does not drop over several minutes. This assures the anesthetist that the system does not have any leaks. All necessary drugs, syringes, endotracheal tubes, mouth gags, anesthetic monitors, and anesthetic machines should be checked, operational, and readily available. Throughout the entire anesthetic sequence, it will be essential that the patient be carefully monitored. Patient monitoring is key to avoiding an anesthetic accident. This will necessitate your constant attention and the use of all your senses. When monitoring an anesthetized patient, you should monitor the following items: the patient's level of consciousness, or depth of anesthesia, heart rate and strength of the peripheral arterial pulses, mucous membrane color and refill time, breathing depth and rate, and body temperature. When the appropriate instruments are available, you may be asked to monitor the patient's electrocardiogram, or ECG. Blood pressure, blood oxygenation using a pulse oximeter, expired carbon dioxide or CO2 concentration, body temperature, and heart and respiratory rates. Let's review a few of the monitoring techniques we've just mentioned. Monitoring the patient is important because anesthetic drugs depress the function of the brain, heart, and lungs. Monitoring eye reflexes is often used as an indicator of the degree of unconsciousness of the patient. Once the patient is completely anesthetized, the eyelids should not respond to a gentle touch. Neither should the patient respond to a toe pinch, and the mouth should open with minimal resistance. Heart rate is the number of times the heart beats in 1 minute. An easy way to calculate this is to count the number of beats in 15 seconds and multiply that number by 4. A stethoscope can be used when the patient's chest is accessible, or an esophageal stethoscope can be used when it is not accessible. The esophageal stethoscope utilizes a tube placed in the esophagus, such that its distal tip is adjacent to the heart. When properly placed, it will allow you to hear heartbeats. The pulse and heart rate can also be evaluated by digitally palpating on the back side of the tongue, or by feeling other major pulsatile blood vessels. ECGs and other heart monitoring devices all provide a real-time look at the heart's electrical activity, rate, and rhythm. Many of these instruments provide both a visible and an audible sound to indicate each beat of the heart. Remember, however, that the ECG does not indicate the strength of the heart arterial pulsations or whether the blood pressure is normal or not. In this program, we will not attempt to teach the science of interpreting the ECG waves. Pink mucous membranes indicate that the patient is being adequately oxygenated and that peripheral blood flow is being maintained. A pale pink color to the mucous membranes suggests a decrease in peripheral blood flow and often occurs if the patient's temperature begins to decrease. It may, however, be an indication of excessive bleeding or poor heart function. Capillary refill time is determined by pressing a finger on the gums and releasing it. The membranes will initially be pale, but color should return, creating a pink color in 1 to 2 seconds. Longer refill times indicate poor peripheral blood flow due to low blood pressure or poor cardiac function. Blood pressure can be measured in many patients by using Doppler or oscillometric monitoring techniques. These techniques are non-invasive, indirect, and utilize a small cuff placed around the leg or tail. Arterial blood pressure is obtained from a pressure gauge, sphygmomanometer. The respiratory rate or number of breaths per minute can be evaluated by either watching the chest move up and down or by monitoring the number of times the rebreathing bag inflates and then deflates. Sometimes steam, evaporated water vapor, can be seen on clear endotracheal tubes during each expiration. Respiratory monitors provide an audible signal with each breath. Many heart and respiratory monitors are equipped with alarms that sound when a patient does not maintain normal values. A pulse oximeter is used to measure the oxygen saturation of the blood. This is done very easily by applying a small clip or sensor to the tongue, ear, skin, or rectum. The instrument provides a pulse rate and the percentage of blood that is oxygenated. A normal value indicates that the lungs and heart are working in sync to oxygenate blood. Continuous monitoring of expired CO2, or EtCO2, permits the anesthetist to determine respiratory rate and whether or not the patient is breathing normally. Monitoring EtCO2 also ensures that the endotracheal tube is placed properly. You should be especially alert to breathing rate when a patient is first anesthetized because many drugs, such as propofol and even ketamine diazepam, cause a period of apnea or a short period where the patient does not take a breath. Manual or mechanically assisted breathing may be required for several minutes until the animal begins to breathe on its own. Monitoring body temperature is important because many patients, particularly those less than 15 pounds, are very susceptible to becoming hypothermic or cold during anesthesia. This temperature drop can be monitored with a rectal thermometer. Attempts to compensate for this drop in temperature include placing a heated water blanket between the animal and the table. Even a common bath towel will help to prevent heat loss to the metal table. Whenever you're asked to assist in monitoring the anesthetized patient, you should implement a system of regularly evaluating each of the variables being monitored. The results should be recorded every 5 minutes on an anesthetic record, which helps minimize and prevent problems. When a patient is connected to IV fluids during anesthesia, you'll need to be very aware of the amount of fluids the patient is receiving. Too much fluid and the risk of fluid overload and drowning the lungs. Too little fluid may allow tissue perfusion to drop too low. By adjusting the rate of the fluid administration to a predetermined number of drops per minute, as observed in the fluid drop chamber, a predetermined amount of fluid is delivered to the patient. Alternatively, a fluid administration pump can be used to provide an accurate method for delivering a designated amount of fluid. When a fluid administration pump is not available, be sure the fluid flow is not being obstructed by the position of the patient on the table. Position the leg to obtain a steady flow of fluids. All of the monitoring techniques we've just discussed serve the purpose of discovering and preventing an anesthetic crisis before it happens. Your ability to responsibly monitor the patient and identifying trends, indicating that the patient is too light or too deep, will free up the surgeon to concentrate on the surgery.